Hi, my name is Richard Schleter. I'm an attorney that practices predominantly here in the Atlanta area. I went to law school at Georgia State University, undergrad at Emory. I've been practicing law for approximately 17 years here in Atlanta. Our firm, Childers, Schleter and Smith, it predominantly does medical device and pharmaceutical litigation. And I'm here today to talk to you about specifically the device that's been recalled, the DePuy ASR total hip replacement system. One thing patients are concerned about when they recognize that they have possibly been exposed to high levels of cobalt and chromium is how do they test for that? The simple answer is there are specialized labs that do testing for cobalt and chromium. Many of those labs are in most of small towns throughout the United States, some of them that operate on a national basis. There are three known methods for testing for cobalt and chromium. One is you can test the urine, another you can test whole blood, and another is you can test a derivative of whole blood known as the plasma of the blood. Specifically, when they're testing for it, they're looking for the number of parts per billion that are associated in studies as being toxic. Currently, what is known regarding cobalt, anything above 5 nanograms per deciliter or 5 parts per billion is known to be toxic. Normal associated levels based upon studies that have been published show that an unexposed person has levels in their system somewhere less than 1 part per billion, actually right around 0.29 of 1 part per billion. So it's a very low level that someone sees, and once you get a toxic level, that is somewhere upwards of more than 15 times what a normally unexposed person would have. One interesting aspect that some of the experts have discussed with me is how their level may be impacted and affected for a person that has compromised renal function or that might have kidneys that are not working as they should in either an older person or someone that has a compromised failure. In conjunction, many physicians are recommending when they see high levels of chromium and or cobalt in their system to also recommend that the person's kidneys be checked, because when one person that's healthy, the amount of material that may be coming off from their device may not impact and affect another person as greatly as one that has healthy working kidneys. There are many different companies that are currently doing the test. I can name a few, for instance, here in Georgia, and that I've seen in other states across the country. LabCorp is a well-known company that's doing the test. In fact, that's one of the recommended labs that is doing it through DePuy, Spectrum, Quest, many others. One interesting aspect, though, to try to make certain is that on the reporting, and we've seen this on some of the LabCorp testing, that it doesn't explain or give the toxic ranges on the test. And many orthopedic surgeons that I've spoken to and have met with have indicated that they were not aware or were not alarmed because they utilized this test and or flags that are put on the test to give them the reference ranges so they can determine what they mean in conjunction with treating the patient. It's important for that patient when they have a test done that they actually physically get the results and speak to in conjunction with not just their orthopedic surgeon, but also meet with their family practitioner or other practitioner that may be treating them in conjunction with other maladies in internal medicine, an endocrinologist, a rheumatologist, or whoever it may be, to discuss with them in conjunction what those numbers mean. If you'd like to learn more information about the DePuy implant ASR and see other videos and find other information, go to hipimplantrecall.net.